We have the hind limb here, right? Here's biceps femoris. We have it transected here. So we're gonna look at the sciatic nerve, which is here. And then that branches into two nerves. So we have the common fibular here. It's going into the extensors. And that also branches into a superficial and deep branch. And then we have our tibial nerve here, basically going into gastrocs here and the hind limb flexors.
So one nerve delves into turns into two?
Yep, sciatic branches into two. Common fibular and then tibial. Okay. And then still here on the lateral side of the limb, we have our lateral saphenous vein, and that branches into a cranial and caudal branch. Okay. Can everyone see this? So we have our saphenous nerve here, and our femoral artery. The vein's in there, but it's kind of deflated. The vein should be in here, okay? So remember, saphenous, artery, vein, and nerve is a branch off the femoral. So we have the saphenous nerve here, and if we follow it deep enough, proximal up the limb, we'd actually find our femoral nerve, right? Okay, so then this is the femoral artery and vein, and then so this is the branch off saphenous here. The saphenous artery and vein branches off femoral. So then here's our medial saphenous artery and vein, and this also has a cranial and caudal branch. And if we continued and followed the femoral artery, the same trunk. So here we have adductor, cut away from the tibia. So here's it diving deep, and then at this branch here, grab it, our distal caudal femoral artery. This branch here, the femoral turns into popliteal, okay? And that same trunk is going to continue through the stifle as popliteal, and then come up on the cranial surface of the tibia as cranial tibial. Okay, so that artery is here. So cranial tibial artery, and that's just going to continue distally down the limb, and once you get to the tarsus, that artery is now your dorsal pedal artery, okay? So that should be it for